Welcome to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. The most urgent topic we're facing in healthcare across the nation is the direct threat of Medicaid funding cuts. Last month, the U.S. House of Representatives passed the budget resolution including $880 billion. That's right, $880 billion, or even more, it's anticipated, in funding cuts for Medicaid, which covers 72 million people in the United States. While any form of cuts to Medicaid would be detrimental to rural hospitals, the actual impact will depend on various policies that are being discussed right now. The most dangerous of these policies include reducing Medicaid matching rates, capping Medicaid funding, and even more. Policies like these all result in significantly less coverage for people with low to mid incomes. The good news is that this bill is receiving an enormous amount of opposition across all party affiliations. But folks, it's going to take a lot. It's going to take a lot more to challenge and to change the current direction of this issue, because I'm afraid it's not going to go anywhere soon in terms of disappearing. We'll provide regular updates on Medicaid funding cuts in the future Rural Health News episodes. On to the damage report. So far in 2025, 10 hospitals in the United States have closed their doors, shuttered, gone. Explanations range from years of neglect to consolidations to even lawsuits. But every closure leaves a significant gap in the healthcare and the coverage and the well-being of that community. Also impacted are the economic losses. From these 2.5 months of closures, thousands of healthcare workers have been laid off, lost their job, forced into early retirement, and the list goes on. Many hospitals have run out of solutions to keep them sustainable, and nearly half of rural hospitals are operating in the red right now. According to Chartis, 432 rural hospitals are currently vulnerable to closure. The Centers for Healthcare Quality and Payment Reform report that most at-risk hospitals are in an isolated rural community. This means those patients will be traveling longer distance for care or not receiving care at all because of the length of travel. What can we do to prevent more closures? It comes back to the relationship between healthcare providers and our payers. We'll need a whole series to unpack that topic, folks. But for now, protecting Medicaid and other important programs is essential to the future of rural health. And now on to our success story. Despite healthcare staffing challenges across the country, the National Resident Matching Program recently announced a new record of applicants matched to residency programs, reporting 52,498 applicants, competing for 43,237 positions. The NRMP actively pursued more program participation by adding 2 new specialties and including multiple application services for residents to secure their positions. Specialties seeing increases in residency placement include primary care and emergency medicine. We are most interested in ensuring that the future of our healthcare generation pursue residency programs and that there are seats available. We have been told most recently that the shortage of physicians by 2030 are going to be astronomical. This is one way to ensure that we can deliver high-quality physicians to rural communities. Thank you to our sources for this episode: KFF, the Center on Budget and Policy Priorities, Becker's Hospital Review, the Chartis Center for Rural Health, the Centers for Healthcare Quality and Payment Reform, Cranes Healthcare, the National Resident Matching Program.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.